Cancer. The word itself sends shivers down the spine of a person who's been diagnosed with it. The family goes through a lot more anxiety, fear when one is diagnosed or one's family member is diagnosed with cancer. By the way, what is cancer? This is just a lump with a lot of abnormal cells which can cause trouble to the patient. We see that as a part of one's aging or part of one's evolution. The journey of cancer is complex, least to say. The journey one takes from having abnormal symptoms to having the diagnosis. The journey where the treatment begins and the treatment ends. And the journey where one recovers from the treatment of cancer, getting back to the normality. There are a number of moments of truth where one comes across which are very important. Choosing the right clinician and the hospital is an important one. Talking to the clinician is an important aspect of it. Having gone through examination, getting through the diagnostic processes, and having a confirmed cancer is another moment of truth. Once this is done, the difficulty starts here. The right decision making is very vital in the process, and that is where tumor boards, multidisciplinary teams come into play, come into picture. Once a joint decision making happens between the clinician and the doctor, the treatment begins. And I think the treatment should be in a way where it is easier for the patient, where the journey is made smoother to the patient, and I think that is where Apollo can make a difference. We touch on a number of points in this cancer journey to make the journey easier. Nutrition and dietetics, very important. Robotic surgery or minimally invasive surgery, very important. Creating awareness within the patient and patient information, very important. Risk communication, very important. So when all of these are taken care of, the patient goes through the treatment, and these treatments are predominantly what we call as precision-based oncosurgery. When we do this, the recovery is much quicker, much slicker. Once the treatment is done, getting the patient back to the community for recovery and rehabilitation is one important thing.
And from a person who couldn't get out of bed at that point of time, you can see me here sitting in front of you, talking and trying to tell you, if you ever have any kind of issues, because in India it's not bowel issues or your abdominal issues is not addressed very easily. You just tell it's nothing and brush it under the carpet, but no, that's not right. If you guys ever feel that you're facing something, or you think that there is something that is wrong with you, especially with your bowels, please pay attention to it, because it is not a small thing.
ನಿಮಗೆ ಕೋಲಾನ್ ರೆಕ್ಟಲ್ ಮತ್ತು ಮೆಟಾಸ್ಟಾಟಿಸ್ ಆಗಿದೆ, ಆಪರೇಷನ್ ಮಾಡಬೇಕಾಗತ್ತೆ ಸರ್. ನಾನು ಅಡ್ಮಿಟ್ ಆಗ್ತೀನಿ ಸರ್ ಅಂತ ಹೇಳಿದೆ. ರೊಬ್ಯಾಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿದ್ದಾರೆ. ಆ ರೊಬ್ಯಾಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿದರೆ ಎಲ್ಲಿ ಮಾಡಿದರೆ ಹೇಗೆ ಮಾಡಿದ್ದಾರೆ ಅಂತ ನನಗೆ ಗೊತ್ತೇ ಆಗಿಲ್ಲ. ಮತ್ತು 15 ಡೇಸ್ ನನಗೆ ಪೋಸ್ಟ್ ಆಪರೇಷನ್ ಏನು ಮಾಡಿದ್ರು ಅಂತಲೂ ಸಹ ಗೊತ್ತಾಗಿಲ್ಲ. ಅಷ್ಟು ನೀಟಾಗಿ ನನಗೆ ಆಪರೇಷನ್ ಮಾಡಿ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿ ಕಳಿಸಿದ್ದಾರೆ. ನಿಜವಾಗ್ಲೂ ಇವರು ಫ್ರೆಂಡ್ಲಿ ಡಾಕ್ಟ್ರು. ಎನಿ ಟೈಮ್ ಯಾವಾಗ ನಾವು ಫೋನ್ ಮಾಡಿ ರಾತ್ರಿ 12 ಗಂಟೆಗೆ ಫೋನ್ ಮಾಡಿದ್ರು ಸಹ ಇವರು ನಮಗೆ ರೆಸ್ಪಾನ್ಸ್ ಮಾಡ್ತಾರೆ.
I had a rectosegment cancer in my intestine. Problem which I had was like vomiting and loose stool since from past 4 months. It was nearly to 12 inches of the intestine. The cancer was spread. So they did a surgery and removed me. So now I'm well and fine now. So I'm able to take all my foods regularly, and I'm working also properly.
Every doctor plays a vital role. The hematologist, the hemato-oncologist, the cancer surgeons, the medical oncologists, radiation oncologists, the nurses, the diet and nutrition people, the pathologists, all of these people become an integral part of our team. Once the cancer journey is coming to the tail end at about 3 to 5 years' time, after the follow-ups, the patient can be returned back to the community safely. So cancer is curable, provided we pick it up at the right time and pick up the right moments of truth. Cancer is not a big problem to worry about, but it is about being aware of what can be done to ease that journey.